So I grew up in Detroit, Michigan, and in a very medical family. My father practiced as a GP, general surgeon, and OBGYN. He did it all. And he was just a phenomenal doctor. And we had an office in the basement of our home the first 17 years of my life. So I grew up with medicine. But I almost came out of the womb doing art. I've never known not to doing art. My maternal grandfather was he was an artist and a musician, and we were absolutely clones of each other. We look alike, have the same sense of humor, and I got all my arts through him. I did all kinds of art since I was a kid, and then my first big hobby actually was taxidermy, which is very anatomical, and it's also very sculptural. At any rate, so I remember announcing to my father that I would be an artist. And my father said, "Son, art's a hobby. And once you do something useful like I do and take care of people, you can always practice your hobbies on nights and weekends." And so he was pretty shocked when I ended up using my art in medicine, but I'll get to that. So during the time I interned, which was at the University of Michigan, after I finished Chicago Medical School, which is way back in 1963, I was in the process of trying to decide what field of medicine I would pursue. But it was the peak of Vietnam, and we all went into the military. 21 of the 24 doctors that interned at the University of Michigan ended up in the Army as soon as we finished our internship. So I served as a support doctor in the 101st Airborne Division, the paratroopers who jumped into Normandy. And then, after 1 year of that, I served as a doctor in the Special Forces, the Green Berets in Panama. It was during this time when I was a Green Beret that I was really thinking about things really seriously and decided that it would be important for me to somehow utilize my art talents in medicine. I had this medical background from my father, my family, and I had this tremendous art background through my grandfather, and I thought I needed to combine both. I didn't know exactly what plastic surgery was at the time, but it sure sounded like something that an artist doctor ought to be doing. So that's how I landed into the field of plastic surgery. When I got into my plastic surgery training, I immediately became interested in the most difficult and most sculptural enigma in plastic surgery, and that is how to construct the missing outer ear. Because in order to surgically make an ear for somebody who is missing their outer ear, one has to do a sculpture of an ear and put it underneath the skin in the region of the ear. But the sculpture of the ear has to be alive. So the only thing that works is this sculptural framework of an ear has to be made out of firm, living cartilage. And the only tissue that serves this purpose is the patient's own rib cartilage. And it can't come from a cadaver or even a member of the family. It has to be the patient's own rib cartilage, or will be rejected and slowly turn into scar tissue and disappear. So this means a fairly large operation involving chest surgery to obtain the rib cartilage to carve, and then a delicate formal sculpture of an ear from the patient's rib cartilage, and then a delicate plastic surgical dissection in the ear region in order to create a pocket underneath the skin into where the carved rib cartilage that looks like an ear will be placed. So you can already see the intersection of my work as an artist and a plastic surgeon. I began doing a number of patients with this technique, because 1 of every 5,000 kids is born with a missing ear. And so there are a lot of kids around with this condition that we call microtia. Micro means small, otia is Latin for ear. So I've done a number of these, and I was lecturing and publishing scientific journals and doing some book chapters for textbooks. I did a 2-volume, 1,000-page book called The Artistry of Reconstructive Surgery, teaching the whole field of reconstructing all the various body parts. And then lo and behold, Paul Getty was kidnapped and his ear was sliced off and sent to the family with a ransom note. And the Getty family had me reconstruct Paul's ear, and the next thing I knew, there were articles about my work all over the lay media. There was a classic in Time magazine, the title of which read, "Surgery as Sculpture, Ears Made New." Now, before the splits of articles reached the lay public, I was practicing the entire field of reconstructive plastic surgery, reconstructing breasts after mastectomy for cancer. I was doing everything, but after this publicity, I had no time for anything but repairing missing ears, 90% of which were birth defects in children. And it takes me 4 to 5 stages of surgery with 3 months in between stages to allow for proper healing. And during my 40-year career, I think I've surgically created ears for, well, I've done ears for 2,000 children. I probably did 10,000 reconstructive ear surgeries in children over a 40-year career. It's been a very gratifying career. So that is, in a nutshell, the intersection of my work as an artist and plastic surgeon. You can see how it all relates. If I'm doing a sculpture, I'm working with clay, I'm working with plaster, I'm working with wax, all kinds of different materials when I'm doing a non-medical sculpture. And when I'm doing a sculpture in the operating room, it's just a different medium. It's all art. Just the medium different. I mainly sculpt birds and mammals. And people have asked me, why don't you do people? I said, well, I'm a very avid naturalist, so I tend to do art of other species. I've done some real big ones for public places, and those are usually big mammals and birds for kids to climb over. But Labyrinth is a sculpture of the inner ear. That's what it is. It's the cochlea and semicircular canals. From the sculptural standpoint, other than its very large size, that sculpture is about 3 feet in length or so, the sculpture is accurate anatomically. But by its very unusual anatomy, it almost seems abstract when you look at the cochlea and the semicircular canals. And therein lies the attraction for me. This is very abstract, but yet it's real. It's very anatomical, but it almost looks abstract just by the nature. Those are the elements of it. All these kids I took care of, 2,000 that were born without ear deformities, and I've dedicated my professional career to repairing their ears, they all have underlying hearing problems. So between that relationship and my fascination with the unique anatomical configuration of the inner ear, made this an absolutely natural subject for me. And it represents the main part of the hearing mechanism in the human, and here I've taken care of 2,000 kids who have a hearing problem. That's what inspired me to create the Labyrinth and what it all means to me. So I become great friends with the kids. And so many of these kids end up, it's interesting, many end up going to medicine. I have this kid whose ear I built when he was 7, and he ended up coming to Stanford to go to undergrad school and then on to medical school. And I get together with him every month over coffee and mentor him. And he's going to go into surgery, and I took care of him when he was 7, so it's pretty nifty, the full circle. And I know of a lot of other kids I've taken care of who have gone into medicine. I took care of a little kid who was a farm girl, and her daddy's horse bit off one of her ears when she was 2 years old. So I started her at age 6. And when she was 17 or 18, I got an email from her. And in this email, she said, as a little kid, I was so impressed that a doctor could do something like you did to turn my life around, that I am in the midst of applying to college in a pre-med curriculum with the idea of going into medicine. And that was a very heartwarming note to receive. That was very, very heartwarming. And my father, he was so amazed. He said, son, this is after I was already practicing plastic surgery, of course. He said, you told me when you were a kid you were going to be an artist. I said, you can always do that as a hobby. You got to do something useful like I do and take care of people. He said, I find it very amusing that you ended up going to medicine, but practice it as a hobby, because it was almost like my main hobby became reconstructing ears for children born with missing ears. That became my main hobby. So that was fun to hear him come to that realization. And I have loved doing it. I feel very honored to have served in this capacity, and I really love taking care of kids.